Borderline personality disorder, BPD. It is a psychological disorder that begins in early adulthood. The mental disorder can be diagnosed as early as late adolescence. This mental condition affects the sufferer's thoughts and feelings about themselves and others, thus causing problems in many areas of daily life. BPD was first identified in 1938 by psychiatrist and researcher Adolf Stern. He discovered BPD when studying a group of patients that could not be described as either psychotic or psychoneurotic. Therefore, Stern introduced new terms, borderline and borderline personality disorder, to represent the group of patients bordering on other conditions. After Stern's first publication of the terms borderline and borderline personality disorder, this mental disorder was finally included in the DSM-3 in 1980. Adolf Stern wasn't the only person researching BPD, many other researchers also investigated the mental disorder. Other notable researchers were Robert Knight and Otto Kernberg. In the DSM-5, BPD has 8 symptoms that are presented. To diagnose someone with BPD, they need to demonstrate at least 5 symptoms to meet diagnostic criteria during a 6-month period. Some symptoms include frantic efforts to avoid real or imagined abandonment, chronic feelings of emptiness, and a pattern of unstable and intense interpersonal relationships. Prevalence rates. Many people around the world are diagnosed with BPD. About 1.6% of the general population in America has been diagnosed with borderline personality disorder. There are many myths about BPD. One myth is that women are more likely to develop BPD than their male counterparts. However, this isn't true because studies have shown that men have an equal chance of developing BPD as their female counterparts. And because of this bias, men are more often misdiagnosed with PTSD. Potential causes. There are 3 potential causes for BPD: trauma, family history, and brain abnormalities. Luckily, there are many kinds of treatment options for BPD. 3 of them are dialectical behavior therapy, mentalizing-based therapy, and transference-focused psychotherapy. Each of these treatment options is effective in its own way and provides coping skills and mechanisms for the individual with BPD. Overall, BPD is a manageable and treatable mental disorder. And with the right kind of care and support, BPD can become a less daunting diagnosis. For more help and support, one should visit the nyp.org/BPD Resource Center website in the description box below or call 1-888-694-2273 and email bpdresourcecenter@nyp.org. The New York Presbyterian website is a BPD resource center that provides resources for help to those suffering from BPD. On this website, one can speak with providers to help them find a BPD therapist in their area and other great resources that help reduce the stress of diagnosing or receiving treatment for BPD.